Okay.
Okay, so now it's recording. I think it's all recording, and you can hear me perfectly, right?
Yeah, yeah.
Okay, so the questions I'm going to ask them in a different order. So I'm going to ask about the children one first, and then
Hmm.
what protective measures would you advise the nursery or schools where safety must be a priority? And then
Hmm.
I'll jump to what's it like in the NHS at the moment.
Hmm.
Um, where's number 3 gone?
With safety measures for nurseries, what do you mean by that? As in like social distancing and stuff within nurseries? How would you? What as in like
Uh,
changing your kids?
okay, so instead of saying nurseries, I'll say what protective measures would you advise people to be taking?
Okay.
Yeah.
Yeah, yeah,
Okay, hold on.
yeah.
What protection measures would you advise everyone everyone to be taking? Because obviously we don't, you can't advise that. And then I'll ask number 3 would be what's it like in the NHS at the moment? And then number 4, how are you keeping safe?
Yeah.
What protective gear are you using? I'll ask the question and we'll just kind of just riff off it.
Yeah, that's fine. That's fine.
Okay, you ready?
I'm just resetting my. Yeah, yeah, absolutely ready. Do you want me to introduce myself? Would you ask me who I am and stuff?
No, I've already done like an introduction video already. So now I'm just gonna just say mm, okay, I'm just gonna start.
Okay.
Hi, Dr. Sidhu. Thank you for joining us in your busy schedule. I'm going to ask you some quick questions that our families, our parents it would help out with. I'm just going to jump in to ask the first question. It's about children. Everyone's concern is about the children. Um, so, are children being affected by this virus?
Yeah, so I think yes and no to some extent. So I think with regards to your question, the one positive or silver lining is that lots of children are affected in a much less a much smaller extent than it is for adults. So this virus is affecting people mainly sort of elderly. It can impact everyone. Everyone can catch it. But the question, I think, what you're asking is how much impact is it having on children?
Yes.
Now we are having cases, or you've probably heard of cases where children are being affected and are unfortunately becoming very sick with it. There's a very small portion statistically at the moment from what we know, and children are getting it. Some children might be exhibiting very, very minor symptoms. Some children might be having no symptoms at all. So with regards to coronavirus specifically,
Yeah.
I would say actually, I think children are at a low risk of getting very unwell comparatively to the vast majority of the population, which I think is a very positive thing. But that said, however, I think it's extremely important to say to parents of children that if children are unwell,
Yeah.
to get them checked out. And this is a very important thing, I think, which you've probably been seeing on the news, where children are much more likely to get unwell right now with the normal things that make children unwell, whether it's bacterial pneumonia, whether it's measles, whether it's anything that could make a child unwell. And I think delaying going in to see your GP or contacting your GP or delaying going into hospital is another way in which I think coronavirus can really impact people, impact children, because the fear of not going in due to coronavirus and allowing you, or you sort of, and your child getting sick due to that, I think is an impact of the pandemic itself. We know lots of people get unwell due to not having access to healthcare. So I think that's very important. I've just had a child with a temperature of 39.6 without a cause. We don't know where it's coming from. I've had to get her to go into hospital, but it required a conversation with me and the mother. And the mother was very, very worried about coronavirus. And I said to her, actually, you have to be more worried about what's causing your child to become sick as opposed to them catching coronavirus, because actually statistically they'll be affected in a very small way
Okay.
if it was coronavirus.
It was corona. How can we
If,
protect? How can we protect our children?
The social distancing measures are the most important way to protect your children against coronavirus.
Yeah.
At the moment, we know very little about this illness, and realistically trying to keep them away from, if there's something that's non-essential, essentially, then try not to do that if you can. And I think that would be the best way in order to try to protect your children. Now, looking at things as well, I mean, taking safety precautions like changing their clothes if they're going on an outdoor play. So say, for example, if you've gone for some exercise in a park, maybe when they come back, change their clothes, maybe have a bath time after that to make sure they're not tracking things in. It seems like you're more likely to pick it up from touching things and then touching your mouth, as opposed to, unless you're getting sneezed directly on. So again, that's something that you would have to do, regular hand washing, and sort of those sort of precautions are probably the best thing to do for your children.
Okay. And what symptoms do you look out for if a child comes in and the mother or father is saying could it be coronavirus? What symptoms are you looking out for?
It's the same symptoms that we look out for any illness in a child. So there are certain what we call red flag features in children.
Mm-hmm.
So a reduction in them eating and drinking, sort of less than 50% of normal. Signs of dehydration. So if they've stopped, wetting nappies or stopped passing urine. If they're becoming very lethargic and listless and not themselves. If they're finding it hard to breathe and puffing away and, using sort of their general muscles and just don't look themselves. I mean, all of these features aren't just a feature of illness from coronavirus. It's a feature of lots of illnesses which children exhibit. So, and those are the things, these are certain things we do look out for. But my main advice is don't delay getting in contact with your GP or healthcare provider just because you're worried about coronavirus. I mean, we are adapting the way we're working in order to be able to manage these things. But I think when it comes to children, and going back to our first point where children are less affected, I think you're more likely to get very unwell from the normal things that make you unwell as opposed to coronavirus if you're a child. But again, we know very little about it, but that's what it seems like it is. So don't delay getting medical advice, I would say, if your child is sick.
And is the recovery rate for children faster than adults?
That's a very difficult question to answer. I think when you're talking about speed and recovery, I mean, because we don't know the whole proportion, if we're talking about averages, we haven't had enough time to be able to say this many people have had coronavirus. I mean, some adults may have had coronavirus and had no symptoms at all. Similarly, with children, they might have no symptoms at all. So it's hard to say. And everyone's an individual. One child might get it and unfortunately might become very sick, which means they have to go into hospital and be hospitalized for a period of time, whereas one adult might recover very quickly. So it's very hard to be able to, I think, compare that. But what it does seem like is that there's a much smaller proportion of children being hospitalized due to coronavirus than adults.
That's good to hear. What protective measures would you advise everyone to be taking?
So yeah, again, as we said, social distancing. I think it's very hard when you've got children. When you go out to play with them, if you go to a park, it's very hard to stop them from touching the park bench and exploring. I mean, they're children; that's what they're meant to do. So I mean, if you've got a garden, I think using that a safe area where you know who's been in that garden and everyone is well around the garden. I suppose if a member of your household becomes sick, try to distance them from the children if possible. Like try not to get them to get too close to the children. Vice versa, if your children are sick as well and you've got elderly people in the house, try to keep the children away from them. Washing hands, I think, was the number one thing that the government said initially when it started, and that's very true today. Washing your hands properly, using the correct technique to wash hands, which is widely available online. And yeah, that's definitely one thing. Those are the sort of the things that you can do. You could go extra, you could change your clothes, when you go out. If you were out, for example, if you're taking your children shopping, get them to change their clothes, maybe have a bath time at that point to try to minimize it. Again, the study and the evidence aren't there, but these sort of things, they won't do any harm. If anything, they would reduce the risk of transmission.
Excellent. What's it like in the NHS at the moment?
So I think there was at the beginning, there was a huge amount of fear. There was a lot of worry and anxiety that actually we wouldn't be able to cope. We wouldn't have enough ventilators or beds, and there'll be people waiting out the door, lines queuing up. And fortunately, I think the social distancing measures have really helped. There's a big change. Again, I can't comment on hospitals at the moment. From what I hear, actually, if you do end up going to A&E, there's probably less people about, because actually people are only going if they are needing to go, which is the way it should be. But again, I can't really comment on that. I know in general practice what we're doing is we're doing mostly telephone consultations. We're minimizing the amount of people that are coming into the practice. And that's to provide a safe environment for those people that do need to be brought in. Often it's the children, so the people that are needing to be brought in are usually children that I'm worried about, or elderly patients, even shielding patients that we're sometimes worried about are coming through. But the great thing is, there's a very small footfall into the practice, so we're trying to make it as safe as possible for those people. We fortunately have had enough face masks in this practice to be able to give the patients face masks to be able to wear when they come in to see us as well, which is beneficial. Obviously, I have all of my personal protective gear, like wearing a face mask, which is actually more protective for the patient than it is myself. So it is safer. We're trying to make it as safe as possible, essentially. It's a very different way of working.
So like you're in the front lines of this, and you're meeting patients that have coronavirus. So how are you keeping, I know you touched on it, but how are you keeping safe against the virus? What protective gear are you wearing? What do you do when you see a patient, and how do you sanitize afterwards?
So we have a bottle of bleach in our room. So every patient that comes in between, I bleach every surface that the patient has been in contact with. Yeah. So that's one thing. I have personal protective gear, so we've got you've probably heard on the news that NHS has very minimal personal protective gear. So this is the only thing that we've got access to from the NHS, which is a surgical face mask, which is 5 times more effective if actually the person who's got coronavirus is wearing it. So if you're wearing a face mask, it basically means that you're less likely to pass anything on to someone else, as opposed to catching it. So it's not so much, it is a bit of a protection for yourself, but it's more protected to other people. So this is one way to keep patients safe from me if I've seen a couple of patients in that day. But that said, also it would stop me from touching my face and touching surfaces. Other things I've purchased on my own is I've bought this like sort of head, just to cover my hair. So in case there's a virus, again, we're in such early stages, we don't know what works and what doesn't. I've also purchased just goggles, because if you get droplets into your eyes, and I've also got a visor here, which I wear as well in front, so it stops. So if there's a child who's coughed, hopefully it doesn't transmit onto my face. Also bought scrubs, so we're wearing different clothing now, and I have a little routine where I have different sets of clothes. So I have my home clothes, and then I have a set of clothes which are specifically just for me to wear in my car on my journey to work. And then I come into my practice, put these clothes on, and then I take these off, leave these at my practice. Then I have one per day. And then I'll put on my travel clothes again. And then before I go into my house, I take my travel clothes off just in my porch, and then I go and have a shower straight away. So that's just to try to reduce transmission of anything that I come in contact with. But again, there's no scientific evidence or studies behind that, but it's just about me thinking, what can I do to reduce, there being something on my clothes if I'm wearing the same clothes from my car. It's basically just doing what I can.
And you just mentioned it, but I'm just going to ask again. When you get home and you're at the door, what are you thinking, and what do you do to make sure that you're not taking any unwanted viruses into the house to protect your family?
So I take my shoes off outside. There was some, studies, for example, where they tested pharmacies on hospital floors, and they found coronavirus in vast majority of pharmacies. So you can track bits of coronavirus around on your shoes. So I take my shoes off outside, and then I'm taking off as much as I can, and trying to touch minimal. I try to wash my hands as soon as I go in, touch minimal surfaces. Things like I've had, for example, my phone. I spray a cloth with some bleach, and then I sort of wipe that down as well. You think if you're going to have that near your bed or something. So just try to think of any surfaces. I have a separate pair of glasses which I have at home, so I take these glasses off, keep these with my other clothes, and then I wear my separate set of glasses at home after my shower. And I think just what's popped on my phone is something about face masks. I don't know, probably after this, you'll probably notice that they're advising people to wear face masks. If you do have access to a face mask when you're out, I think it's probably not going to do you or others any harm. It'll probably help reduce transmission for sure.
Okay. And a final question, any personal advice you can give to the people watching, like the advice you gave me about the vitamin D levels and having vitamin D, any advice that you can give others? And why did you advise me on that?
Well, at the moment with regards to COVID-19, we're in such early stages of this illness. This is probably an illness that will be around for years. It's not something we're going to get rid of. You know, it might be like where you've got flu, you might have people with COVID-19, and hopefully as time goes, people have, you know, milder symptoms. But because we're so early, we really don't know. You're getting lots of different advice from America, different advice from, you know, all over the world saying, you know, this is good, this is good. You've also got to be very careful about the advice. So I think there was some stories about, they said hydroxychloroquine, which is an anti-malarial tablet, can help, and the evidence wasn't great, and still isn't great. And I think some people in America started taking it, and it's quite a dangerous drug, and they took it and ended up passing away from it. So you've got to be very careful what advice you take. And they didn't even have coronavirus. But there have been some studies. So I think the biggest thing that caught my eye was initially that people from Black and other ethnic minorities basically were getting very sick. And if you looked at the names of the initial doctors that were dying, I think all of them were sort of like either African Caribbean or from Arabic descent or sort of India, Bangladesh, and it made me think, I wonder why. And there was some studies into it saying, do they live in closer proximity? Do they sort of live in sort of more congested households? But then you think, well, sometimes the doctors maybe they don't live in big households. The other thing that came to mind, and lots of people started doing studies on, was vitamin D. And again, there's still no evidence behind it, but you've got to think about what is the risk of taking vitamin D. Now, the NHS advises everyone to be taking vitamin D regardless, because we know that the rate of deficiency is huge. So when it comes to children, your health visitor, when your child's born, they'll say, listen, start taking a vitamin D supplement. You might give your children things like an Abidec or, Well-Kid vitamin D. And these are just things that you would give them, those little chewable things. And it's something that everyone should give. And I advise all my patients prior to this to be taking. And now even more so, because actually if it does turn out that vitamin D is helpful, and there has been studies, and even in the news they're saying actually take vitamin D, you've got to think, what harm is this going to do to us? And actually it's probably not going to do any harm. It's probably going to do you good. And if you have low vitamin D, and it means that the theory is that it makes, if you get coronavirus, the symptoms become worse if you've got low vitamin D. But again, it's a theory. If you can help negate that risk, then why not? And it's not going to do you any harm. So I would say, yeah, if you can, I'd say take vitamin D. I take it myself. I've been taking it for years, and it does have an impact on our immune system. We don't know exactly the mechanism by which our immune system helps to fight this virus. So that would be my advice.
Thank you so much for that. That's valuable advice. I give vitamin D, that we can get vitamin D spray for children. That's what I've been giving to my children as well. And from your advice, which you gave me a couple of weeks before it even came out in the media, we've been taking the tablets. So we can purchase these tablets easily from the pharmacist, right? The vitamin D ones.
Yeah, absolutely. Or even on Tesco online, Amazon will sell it. There's lots of different forms as well. It's not only the spray or the liquid. You get these chewable sweets which have vitamin D in them. So yeah, there's lots of options for children.
Fantastic. Dr. Sidhu, thank you so much for your time. We really appreciate it. We appreciate your time. We appreciate your patience, and thank you for everything you're doing for us on the front lines, attacking the virus and winning. So thank you so much.
We're going to get through this together. Absolutely. Fantastic. No problem at all. Thank you.
Thank you so much.
Thanks. Bye.
Bye. All right, that's done. I'll cut it from there. Cool. Thanks for that. Do you want anything edited out?
You'd whatever. No,
I
I
thought
don't really
all
mind.
the information was brilliant. I mean, the parents would love that because it's a lot of information. There's some things that I didn't even think about, so I was like, oh, geez. So I'm gonna actually I'll edit it a bit and I'll send it over to you. It's
Yeah.
quite long, but I'll do that and then
I think the main point is that children, if your kid's sick, go to the doctors. Don't worry that, oh my God, I'm going to catch coronavirus, I'm going to stay at home.
yeah.
I've had 2 patients I've seen today, both children. One's fine, one I've sent into hospital. So we speak to them over the phone and stuff. And if I'm worried, I'm like, listen, temperature 39.6, that's pretty high.
Yeah.
Unless the only time I'm comfortable is if you've got tonsillitis, because that often does it. And I give you, they didn't have one. So I was like, well, you got to go in now. So yeah,
Okay.
that's the main thing to tell your parents, I think.
Cool. I'm gonna post this on the Facebook pages. Is that okay?
Yeah, I suppose I don't think I could, just giving this sort of informal advice, I don't think I need any insurance or anything.
All right.
I
No worries.
assume jokes, whatever, that's cool.
All
Yeah.
right then. Okay.
All right,
Thank you so much,
okay.
Jah. Thanks. Bye.
Bye. Bye.